Bismillah ar-Rahman ar-Rahim. In this lecture, I will explain to you how the healing of wounds occurs in the body after trauma. There are different types of wounds. Psychological wounds are more difficult to manage than traumatic wounds, but in this lecture, I will only focus on the healing of traumatic wounds. Learning objectives. By the end of this lecture, the students will be able to describe the normal wound healing mechanism, describe healing in soft tissue, describe healing in hard tissue, list factors influencing the healing of the wound, describe the intentions of healing, mechanism of wound. Healing. Wound healing is a mechanism whereby the body attempts to restore the integrity of the injured part. Phases of healing. The inflammatory phase, the proliferative phase, the remodeling phase, maturing phase, the inflammatory phase. In the initial phase of inflammation, there is the presence of a blood clot rich in platelets and dilated blood vessels. As a result, there is an increase in blood flow to the affected area, leading to redness and swelling. This initial response is crucial for delivering immune cells and nutrients to the site of injury, initiating the healing process. Late inflammatory phase. There is a higher level of blood vessel development and a rise in the number of polymorphonuclear leukocytes and lymphocytes, round cells. This increase in blood vessel development and immune cell count indicates a heightened inflammatory response in the body. This could be a sign of infection, injury, or another underlying health issue. Further investigation and monitoring of these changes are necessary to determine the cause and appropriate treatment. Proliferative phase. During the proliferative phase, capillary buds and fibroblasts are active. By the third day, fibroblast activity is noticeable, and by the third week, collagen and ground substances, glycosaminoglycan and proteoglycans, are being produced. This phase also involves the growth of new blood vessels as capillary loops, angiogenesis. It's important to note that fibroblasts need vitamin C to produce collagen. Proliferative phase. The wound tissue formed in the early part of this phase is called granulation tissue. An increase in the tensile strength of the wound due to increased collagen type 3 is associated with wound contraction, which can considerably reduce the surface area of a wound over the first 3 weeks of healing. The remodeling phase, maturing phase. The remodeling phase, maturing phase, is characterized by the maturation of collagen, with type I replacing type 3, until a ratio of 4.1 is achieved. During this phase, there is a realignment of collagen fibers along the lines of tension, decreased wound vascularity, and wound contraction due to fibroblast and myofibroblast activity. This maturation of collagen leads to increased tensile strength in the wound, which is maximal at the 12th week post-injury, and represents approximately 80% of the uninjured skin strength, resulting in a mature contracted scar. Factors influencing the healing of the wound. Site of wound structure involved, mechanism of wounding, contamination, loss of tissue, vascular insufficiency, previous radiation. Pressure vascular insufficiency occurs when there is a lack of adequate blood flow to a specific area of the body. This can be caused by various factors, such as prior radiation treatment or pressure on the blood vessels. When these conditions are present, it can lead to serious health complications. Systemic factors that can contribute to health issues include malnutrition, diseases such as diabetes mellitus, medications like steroids and immunosuppressives, immune deficiencies such as those caused by chemotherapy and AIDS, as well as smoking. These factors can all have a significant impact on overall health and well-being. Classification of wound, closure, and healing. Primary intention. The classification of wound closure and healing involves the process of bringing the wound edges together to promote normal healing with minimal scarring. This method is known as primary intention healing. Secondary intention. Open wounds heal through a process called granulation, contraction, and epithelialization, where the body's heightened inflammation and proliferation can sometimes result in the formation of a less than ideal scar. Tertiary intention. Delayed primary intention. Tertiary intention, also known as delayed primary intention, involves initially leaving the wound open and then later closing the edges when healing conditions become favorable. This method allows for more thorough healing and reduces the risk of infection. Thank you for listening this lecture.